This video is going to be on socket grafting. This slide right now shows bone grafting for dental implants. I think this shows kind of step by step how this whole process works. So let's run through it real quick. Imagine a patient comes in this picture number 1, and they've got a fractured tooth. Okay? Nothing can be done to save it. The tooth needs to come out. Here in picture number 2, they show if you were to peel the gums back, the gums aren't really peeled back. It just shows what's going on underneath. So the crack is going up onto the root. Nothing can be done. It also shows that there's a bony defect. Most of the time the bone, they have kind of like a smooth collar bone, but here you can see it goes and has a little peak, and then it comes back. Now let's move on to step number 3. Tooth is taken out, okay, and there you have it inside of here. There's going to be a hollow socket, okay, where the root used to be. So in that socket, we're going to place this bone graft material. And this is kind of a granular, sandy sort of material. We mix it with sterile water, and we kind of make this slurry paste, and it goes up into the socket. So we take what used to be the root, and in its place, we put this graft material. Now that's granular, so it has to be held in place. So picture number 5 shows this thing called a membrane. It's this, it kind of shows right here, it looks like a little strip of material that is put over the socket, kind of holding all that graft material in place. And then number 6 does show now some stitches in place holding the gum tissue and the membrane actually in place. Here they show like 3 parallel stitches. We don't usually do that. We usually do like a crisscross because the gum tissue coming from the tongue side and from the lip side or cheek side, they don't quite meet in the middle. So even though this picture shows gum tissue being completely brought together, whenever we have an extraction case, I'm like saying a back tooth, the gum tissue doesn't reach across that opening. So that membrane is what goes on top, and we put a little crisscross over the top of it to hold that membrane in place. Okay, and then number 7 shows the site healed in. Months later, an implant can be put in, and then after that, we have the implant and crown abutment can be put in place. Let me show you another example of why we do socket grafting. Here you can see a tooth needs to come out, is taken out, and then grafting was put in. And here they kind of show that if you put in grafting, that you'll maintain a nice wide area going from buccal to lingual, and also you'll be able to maintain some height as well, going from top to bottom here. If you don't put that in, then at least this cartoon shows that you run a risk of the teeth tipping in a little bit. But I don't know if that really is going to happen so much. I'm more concerned about this next slide, which shows what happens when there is no graft. When the tooth is taken out, that ridge gets very narrow, whereas on this other one, the ridge stays nice and thick. You can imagine an implant can be put in there, no problem. Now, what if about a bridge? Okay, you could put a bridge in there, and that'd be great, and the grafting is going to help hold that, but since there's no implant in there, the bone over time is going to get more narrow, and it's also going to get shorter. And so that pontic will look great the day we put it in, but many, many years down the road, that gum tissue will start to get more narrow, and then it's going to start trapping food, and the patient's going to have to get a new bridge to put in there. But that's just a problem. Like I said, it takes many years for that to develop. Now, having said that, though, we'd like to get an implant in there soon after the extraction. It usually takes about 3 or 4, maybe up to 5 months for that socket site to become mature enough to put a dental implant in. But you could wait a year, maybe 2 years at the most, before you get to do a dental implant. The longer you wait, though, beyond that ridge starts getting skinnier and skinnier. It becomes a little bit more difficult in order to do that. Now, if it gets too skinny, I don't know about this picture right here. This might be too far gone, but surgeons sometimes can rebuild that, but they're going to have to take bone from another part of the patient's body, whether it be from the chin, the ramus, maybe even part of their hip, and actually kind of tack it in place and try to rebuild that. So that's much more extensive and expensive to do. So we'd much rather just preserve the socket at the time of the extraction. All right, thanks.